everyone, welcome back to the channel. I hope you're all doing well. Today on Grapes, we are diving into an important health topic that affects many people: the link between obesity, diabetes, and cancer risk. Did you know that being overweight and having diabetes significantly increases your risk of developing cancer? It's true, and it's one of the key reasons why managing your weight is crucial if you are living with diabetes. So why does this happen? When blood sugar levels are consistently high due to diabetes, it can lead to chronic inflammation, which provides a perfect environment for cancer cells to grow. Add obesity into the mix, and things get even more complicated. The excess fat can impair your body's ability to produce insulin and weaken your immune system, increasing the likelihood of developing various complications, including cancer. But here's some good news. Recent research has found that a specific type of medication, known as GLP-1 receptor agonists, could help lower this risk. These medications not only help in managing blood sugar levels, but also have a significant impact on weight loss. And according to studies, this weight loss can dramatically reduce the risk of obesity-related cancers in diabetic patients. For example, the risk of gallbladder cancer can be reduced by as much as 65%, pancreatic cancer by 59%, and liver cancer by 53%, among others. This is pretty remarkable. This is big, but medication alone isn't the full answer. You still need to pair it with a balanced diet and regular exercise, especially strength training, which is crucial for improving insulin resistance and maintaining muscle mass. So if you are living with diabetes and struggling with weight, don't just rely on medication. Focus on an approach that includes exercise, healthy eating, and staying active. That's it for today's video. If this video has helped you, even a little, please give us a thumbs up and share it with your loved ones. Your likes and subscriptions greatly support our video production. Thank you for watching.